Screw placement in mandibular symphysis area. We can put screws in symphysis area to intrude the lower incisors, for example. In this area, the cortical bone is very thick and dense, but as the space between the teeth is narrow, it is difficult to place the screw between the teeth in attached gingiva. So we should go further down to the mucosa. But as we go down, there is just plenty of tissue. So we should consider to use so-called closed method. But in many times, you can put the screw without incision. Even though we applied open method without incision, the head can be covered by the tissue later. We can put a screw between lower central incisors, or 2 mini screw between 1 and 2, sometimes between 2 and 3 as needed. In choosing a screw, movable mucosa, no danger anatomic structure, dense and thick cortical bone. So for stability, we'd better choose large in diameter, but for safety, you may compromise and use one a little bit smaller in diameter. To minimize tissue irritation, the head should not be exposed too much. I prefer to use 1.6 mm in diameter, 6 mm long screw. Let's see typodont. It is very difficult to put screws between the root of low incisor due to narrow space. We should lower the position apically. Trying to put between the roots as much as possible. It is important to find a safe, stable, and minimal irritating position. Once the insertion point is determined, start the insertion. You can set the path of insertion as needed, even though it is much safer to insert the screw toward the apical direction. But if the purpose of the screw is to intrude the lower incisors, for example, the path should be set accordingly. The way to give retention for the elastics, etc.